Welcome to Mental Health Matters, a compelling series brought to you by Ontario Shore's Centre for Mental Health Sciences. Every week, we share stories of hope, recovery, and resilience, accompanied by expert advice and resources to help navigate and understand the complexities of mental health. Situated on the shores of Lake Ontario, Ontario Shores is a dedicated public teaching hospital. We provide specialized assessment and treatment services for those living with complex and serious mental illness. Our unwavering commitment to exceptional patient care is built on safe and evidence-based approaches, ensuring successful outcomes through clinical best practices and cutting-edge research. From adolescents to geriatrics, our recovery-oriented environment fosters discovery, recovery, and hope. Mental Health Matters is an opportunity for all of us to learn, grow, and support each other on this journey of well-being. Each episode focuses on breaking down the stigma surrounding mental health through crucial conversations and fostering empathy within families, schools, workplaces, and communities. Join us as we embark on an exploration of the topic of mental health. Together, we make a difference.
Welcome to an insightful episode of Mental Health Matters on adolescent mental health with a special focus on eating disorders. My name is Julie VanHartingsvelt and I'm delighted to be your host. Given today's topic, it is my honor to introduce Jett as co-host. He's an incredible young man and a mental health advocate. Today, we will raise awareness about these critical issues, as well as the innovative Eating Disorders and Adolescent program at Ontario Shore Centre for Mental Health Sciences. To get started, Jett will begin by interviewing Dr. Neil Onzai, an Ontario Shore psychiatrist. Sterling then joins us to talk about his personal experience and important advocacy work. Chelsea, a brave advocate, and Stacy from Ontario Shores will join us in the final segment. Together, they will provide a comprehensive picture of adolescent mental health, as well as the resources and support to young people. Join me and our guests as we discuss and inspire change in adolescent mental health. Welcome, Jett, and welcome, Dr. Onzai.
Hi, Julie. Thanks for having me.
Thank you, Jett. To get started, would you mind sharing a little bit with our viewers? What's your name? How old are you? What do you like to do in your spare time?
Okay, I would be more than happy to. My name's Jett. I'm 15 years old. I like to go for a walk just to chill all my stress. And that's important for my mental health.
That's great, and that is really important for your mental health. Again, thank you so much for being here today. Would you like to start us off by asking Dr. Onzai some questions?
Please. Hi, Dr. Onzai. I have the first question for you.
Sure.
What's your role at Ontario Shores?
So I'm the medical director of all the eating disorder programs here at Ontario Shores. Last year, Ontario Shores recruited me from the United States to reimagine and to upgrade their eating disorder programs.
Very interesting. What type of programs are available at Ontario Shores to help kids with eating disorders?
Well, we have two programs right now. So the first is called a live-in program. So it's in the hospital where teenagers come in with anorexia or bulimia, the two primary eating disorders that we treat. And they'll stay for anywhere from 2 to 4 months so that we can treat them in a very intensive setting in the hospital. And then we transition them home. The other program we have, which just started a few months ago, is the day treatment program. So that's designed for kids who can get here during the day. It's 8 hours a day, 5 days a week, and we do intensive outpatient treatment with them and their families so that we can prevent them from being in the hospital.
Thank you. My next question is, what makes these programs special and different from others?
Well, again, we have two programs. So the Eating Disorder Unit, EDU, is a program for adolescents with anorexia and bulimia. And what we've done is the province of Ontario has set up a program where kids who aren't doing well enough in other programs can come to us and they get more intensive treatment to fully recover from their eating disorders. So we do quite a spectrum of different interventions for the kids and their families to help them learn about the eating disorder, to start recovering, to be able to eat normally again, and to prevent them from relapsing, as well as getting them further along in development and fortifying their sense of who they are so that they're more positive and confident about their future, hopefully to prevent relapses in the future. The other program we have is the eating disorder day treatment program, and we do a similar spectrum of services, but hopefully we're getting kids that are earlier on in their illness so we can keep the total time that they're stuck in the eating disorders shorter and they can get back to their normal life sooner.
Thank you. My next question is, how can we tell if someone might have an eating disorder or other mental health concerns?
Well, so let me go back to the two disorders that we treat. Anorexia nervosa, that's a situation where someone gets very concerned about wanting to lose weight and then gets to lose weight, start losing more and more weight and becomes obsessed, and then they start to have a distortion of what their body actually looks like. So they can't see their bodies correctly. And so they end up just having what we call body image distortion. They start to believe they're fat even when they're dangerously thin. So as parents or as friends of other kids who are having problems, you'll start to see someone lose weight, become more obsessed about having to be as thin as possible, constantly thinking that they're fat, then starting to withdraw and starting to look sick and getting tired. And so when you see something like that, it's important, it's critical that you get them help as soon as possible, because the longer this goes on, the more damage they do to their body and their brain, and the more long-lasting the effects on this kid is. For bulimia, this is a situation where these are kids that are also trying to lose a lot of weight, and they go to extremes. They eat so little food that they start to get intensely hungry, so that when they actually eat, they're so starving, their body just wants them not to starve. And so you eat a lot of food and it feels out of control, then you panic and you're afraid you're gonna get fat from eating that much food. So then they end up doing things like vomiting or over-exercising or using other methods to get rid of the calories and not gain weight.
If we could just refocus back to the adolescent eating disorder programs at Ontario Shores, both inpatient and outpatient. When I think about an inpatient, or what would a day in the life of an inpatient at Ontario Shores look like?
Okay. So actually we're called a live-in facility, just to take some of the stigma away from being in the hospital. But it is in a hospital, but it's in a less institutional setting. So typically a day on the unit would be start out with having meals. We have meals and snacks throughout the day, and we try and normalize that and help the kids learn how to eat the appropriate amount for their recovery. Then they spend the day going to multiple therapy groups and also being seen individually by a therapist, by myself, by the dietitians. So we help educate them, and we also bring in their families so their families can be educated and learn how to support someone. Both of our programs also are connected with the school districts so that the kids still try and keep up with their schoolwork. A lot of the kids are very focused on academics, so they want to make sure they don't fall behind too much at school, so we encourage that. As time goes on, then when the kids are doing better, we allow them to go on the grounds. We take them out for walks. Sometimes we have excursions into the community. They go to farms, to restaurants, to shopping centers, just to start getting them back into the flow of normal life. And then we have the families come in and we do either 1 hour sessions for families, or once a month we have an all-day session for families where the kids participate in that as well. And they get the support of other kids and families who are going through this so that they feel as if they're going to be able to make the transition back to home and more standard outpatient treatment so that they'll be successful after that and hopefully not relapse. So we're constantly trying to keep the kids busy and occupied. It's not that you're just sitting around waiting to be fed or getting medical care. It's like we're constantly engaging them in a lot of different activities. And of course, they're teenagers, so we just have to have some fun activities as well.
What would some of those fun activities be?
Well, we have, for instance, recreational therapists who take the kids down to, we have a gym in the hospital, or they go for walks and learn how to exercise normally and not just to be focused on exercising to burn calories. It's exercising to have fun, to lead a healthy lifestyle. We take the kids out for movie nights. There's actually a movie theater in the hospital, and so they can go to the movie theater. We have a bowling alley. Sometimes they'll bowl or play ping pong, shoot baskets, play volleyball, all those normal kinds of things. We also take the kids to a farm, and they're able to interact with animals because animals can have a very soothing effect on the kids. So we do as much as we can to keep them occupied.
How do the doctors and nurses at Ontario Shores make sure that each kid gets the right kind of care?
So what we know about eating disorders, they don't come in isolation. It's not just you have anorexia or bulimia and nothing else. Usually what happens with eating disorders is they start affecting all parts of your life. So we have to individualize care for that kid and that family. The families are also under a lot of stress, so we design some standard interventions to help families, but also individualize so that we can educate, so that parents who have to take over the care when you leave our treatment program, they know how to keep kids doing well. They know how to talk to their kids so that if a stress comes up, they don't use the eating disorder as a way of coping with the stress, but then they use other resources to help deal with the stresses that come along in normal adolescence. Teenagers are going through very difficult times. Life is so much more complicated now than it was when I was growing up or when Julie was growing up. And so we don't want the eating disorder to become the only way you cope with that stress in life. You have to learn how to manage those things. And if you have other things that are going on in your life, we customize your treatment plan. If you have what we call comorbid disorders, such as some people have other diagnoses besides the eating disorders, they might have depression or anxiety or obsessive compulsive disorder, or have gone through various traumas, we also customize the treatment to help them with that and help the families learn how to help their kids.
Thank you so much for sharing your time with us today. The information you provided is invaluable. Up next, we have Sterling, who was an inpatient here a number of years ago to share some valuable insights. Again, thank you for joining us, and thank you, Jett, for your co-hosting abilities.
Thank you.
Yeah, thank you, Jett and Julie, for having me on.
Thanks so much.
It's now my pleasure to welcome Sterling. Sterling, welcome to our show.
Yes, thanks for having me.
It's my pleasure to introduce you to Jett, my co-host today, who has the first question for you.
Thanks, Julie. My first question is, can you tell us a bit about yourself and your journey with mental health?
Yeah, so I'm Sterling, I'm 20. I'm a biochemistry student at Trent University and a mental health advocate. My experience with mental health and mental illness began just after I graduated from elementary school. And I sort of was really worried about the transition from elementary to high school and the increased academic stress that came with it and the social stress that came with finding new friends. And so that stress sort of compounded on each other. And I began exercising more and changing how I eat. And that sort of morphed into an eating disorder. And by that end of sort of the winter of that year, I was hospitalized. And that began a cycle of being in and out of treatment for the rest of my time in high school. But I was able to access lived-in care from Ontario Shores in the winter of 2020. And just as the pandemic hit, I was at Ontario Shores and had to go home, receive some different outpatient care at home, and was able to get well enough mentally and physically to be able to go to university and do well and get to a point where I'm here, I'm recovered and happy to be here.
What advice do you have for young people who may be struggling with an eating disorder or know someone who is? How can they seek help or support?
Yeah, so I think definitely for young people that have an eating disorder, definitely talking to someone about it. It's hard to deal with an eating disorder on your own. It's really hard, but recognizing that you have a problem or an eating disorder or issues that might be disordered eating or something is a really important first step. So once you're there, definitely talking to someone about it, whether it be a parent, a teacher, a counselor at school, talking about it is a great next step. There's also resources online you can look for. Sheena's Place in Toronto has some different support groups that are available. NEDIC, the National Eating Disorder Information Center, also provides different resources that you can find and an opportunity to look at their directory of resources. So definitely reaching out to someone and connecting with resources is a great way to get help. And if you're trying to support someone, it's kind of a similar way. I would approach them in sort of a non-judgmental way, somewhere where you're in a safe space, where it's private and you're talking to them about the issues. You're not accusing them or saying, you have an eating disorder, because you can't make the diagnosis as a lay person. So you're talking to them about it. You're saying, I'm worried about this, I see that. I'm a little bit worried about you. Can I connect you with some resources? And then it's a good idea. Just, people in general, we should have an idea of what different mental and physical health resources are available in our community. And so when you have that knowledge, you're prepared to deal with those situations.
Smiling because you are such an incredible advocate, which brings me to my next question. Can you tell me a little bit about your role as an advocate, and how did you become involved? As when I think about your recovery journey, to end up where you are today, such an incredible advocate, collaborating, and we didn't even touch upon all of the work that you do for Ontario Shores and beyond. Could you share a little bit more about, first, how did you get involved, and two, what other work are you doing?
Yeah, so similar to you, I'm also surprised to be here too. I remember when I was first sick with my eating disorder in high school, I didn't want to talk about it. I tried to make up excuses. I can't do this because I'm sick, and wouldn't really explain more. And I remember, going through my journey in treatment and meeting a whole bunch of different co-patients and staff, and really feeling inspired by their stories. And recognizing the fact that more needed to be done. I saw people who, were begging for help, but they didn't have the right resources at the right time. And so, I noted that when I was there, and when I got to a point where I was, better, I was like, I want to do something about that. I want to make sure that people who are in my situation or the situation of my fellow patients that I met along the way had the support that they needed to get better at the right time. And then I connected with some groups at Trent Active Minds. They were like a local at the university mental health advocacy group. And so through them, I felt comfortable to share my story. And once I shared it there, my confidence grew, and I felt more comfortable to share my story more broadly, get involved with Ontario Shores, do some work with Ontario Health. And so in doing that, I really feel like I'm giving back to support the resources that help me, and also shape a system where people have the support they need at the right time.
Thank you. As we wrap up our discussion today, in your advocacy work, what changes or improvements do you hope to see, or society understands and supports as it relates to whether it be mental health or an eating disorder in youth today?
Yeah, so I definitely want there to be more streamlined access to care. So whether it be, someone goes to a doctor's office, they're like, I'm really struggling with eating. I want them to be able to have, comprehensive assessment available to them, where the family physician knows how to assess whether they have an eating disorder or whether they need more support, and then have that support be available to them, so the family doctor can refer them to somewhere to get that help, and they aren't sitting there on a wait list for an extended period of time. Because I know from my experience that being on a wait list when you want to get better, but you feel like you don't have the support to, is really hard, because you just feel yourself deteriorating. So definitely that access to care, and then having the right care. So let's say you get there and it's not working for you, having another option to go to is also something I want to make sure that people have, the next step up in care, the next step down in care, to make sure that they're feeling supported, and the care is meeting them where they're at in their journey.
That's very important. Something that really struck me, you said right resources, the right time. And I'd say the next iteration of that, and the right fit, and being prepared to adjust if it's not the right fit is okay too.
Absolutely.
Excellent. Thank you so much for joining us here
thanks
today.
For having me.
Thank you again, Jett, for being our co-host. And we really look forward to our work together, Sterling, and thank you for all you do.
Yeah, thanks for having me.
Welcome. We're happy to have you both here as guests. To get started, Chelsea, welcome back. You are a longtime advocate of Ontario Shores, and we're so grateful for all the work that you do on our behalf. Could you tell us a little bit about yourself, your personal journey and experience with mental illness, and what brought you to be such an advocate of Ontario Shores in our work?
Yeah, of course. So my mental health journey, I'd say, started when I was about 13. I started experiencing intense anxiety and depression, which led to a series of hospitalizations. And then in December of 2024, I had just turned 16. I ended up in Ontario Shores. I was very terrified. I had consumed a lot of media that would painted it to lead me to believe that it would be a place that was scary. But it was brightly lit. It was a welcoming atmosphere, and I really received quality care
Can I just pause there for a second? How old were you at this time?
16.
16, so young. Yeah. Sorry.
No, that's okay. It's definitely strange thinking back to it now. I'm 25, so looking back at what I experienced at a young age really shaped me to become who I am today. When I got in Ontario Shores, I was struggling a lot with anxiety. Mainly, I had spent about 8 months in my house. I didn't go to school. I couldn't speak. I couldn't have conversations. and I was very suicidal. I stayed in Ontario Shores until May of 2015, a little bit after my 17th birthday, and it was transformative for me. I went back to school. I got my my diploma from high school within, I want to say, a year. And at that point, I had only had enough credits to be in grade 9, and I should have been in grade 12. And then I ended up going to university. I got my bachelor's degree, and I'm currently completing a master's degree. And I definitely wouldn't have done this journey without the support of Ontario Shores.
That's incredible. What's your master's degree in?
Counseling psychology. So
what is it that you hope to do?
I hope to work with adolescents.
How meaningful. And I imagine you have some incredible lived experience to share to really, coupled with your education, relatable. So with that, Stacey, welcome. You've been on Ontario Shores for just over a year and a half now. Very happy to have you. Maybe you could share with our viewers a little bit about your role and what you do here at Ontario Shores.
Sure. So my role here at Ontario Shores is a clinical manager role for the adolescent programs. So we have an inpatient unit, an outpatient unit, and day program. And my role is to oversee the operations of the program, to support our interdisciplinary teams to be able to provide the best care we can for youth who are admitted into our programs here.
Excellent. Thank you. I'm going to go back to Chelsea for a second. I feel like you touched upon it in your introduction. When you think of Ontario Shores, how specifically did the care here, in particular on the adolescent unit as an inpatient, contribute to your recovery journey?
The care here was, like I said, transformative. For me, what was huge was the use of empathy that the staff had. I felt supported because when you're an adolescent and you're experiencing mental health issues, it's often seen as an adult problem. You tell adults in your life and it's very much well, you don't pay bills, so what could you be sad about? Or in 10 years, this won't matter very much to you. The staff here was phenomenal, and they really recognized the fact that I was still a child as well. So all those little things, like I remember I was in here and I missed a dance I'd been looking forward to at school. And I was very sad about it. So the staff put on music for me and sat with me with my favorite music playing. So just being able to be recognized that I wasn't just a number, I was a patient was huge. And the fact that they worked with me to get back into the community. So I started actually attending my high school while I was still in Ontario Shores. And then I would receive support when I got back to the unit. We'd go over the day, and that was huge. I didn't feel at all like I was thrown without a life raft. I felt supported throughout the entire thing.
That's really important. And I imagine that many of those staff are still here and working on that unit. Beyond empathy, which we hear, and compassion time and time again are really key in those who deliver mental health care. Stacey, beyond compassion and empathy, which we know is really critical, very important skills for those who work in the mental health care profession, and what additional approaches and resources are available within the adolescent program to address the specific needs of young people who are facing a mental health challenge?
Sure. So within our program, we do have multiple programs, but I'll start with what's available in our inpatient unit. Our inpatient unit works really hard to support the youth with reintegrating back into their care, and we really work on from the perspective of the goals that the youth have identified to be really important to them, while also stabilizing and supporting their recovery. We do that by having a daily program. So the kids, while they're with us on the inpatient unit, they are working on academics in a school-like setting. They're able to contribute in whatever way they can to their academic recovery. And then when it's time for discharge, we're able to help transition them back into their home settings or their home schools. Throughout the day, though, they're also getting treatment to work on those symptoms. So it could be medical treatment, which is the medication, but they're also engaging in nurse health teaching groups. They're engaging with our child and youth counselors around coping strategies. And they also have a therapist that they meet with regularly when they're on the inpatient unit. So each youth presents with different needs. So we set up individual care plans to help meet those needs, along with including families. So the family or caregiver, we want to also include in that recovery journey. So we support that through family therapy sessions. And we also work with our community. So case conferences happen on a regular basis where we want to include the agencies within the community that are going to help support the youth when they're discharged from the inpatient unit.
Chelsea, based on your own personal experience, what advice would you have, or do you have, for a youth or a child, young adult, who may be experiencing a mental health challenge that doesn't know where to begin? Who do they talk to? What do they do? Perhaps they're unsure whether or not what they're feeling is even a mental health issue. Do you have any advice for them?
I would say that their feelings are valid. I always tell the youth I used to work with that they're their experts. So if they feel like something's off, identify that safe person. So that safe person could be a parent, but if you don't have that relationship with your parents, it can also be a school counselor or someone within your community. And then also, it does get better. It seems very overwhelming. But with the right support, and even if it's not something that you require intensive treatment for, if it's you need to talk to a counselor once or twice just to kind of help you out, there's no shame in it. It'll set you up for success in the future, and you're definitely not alone.
Excellent. That's really good advice. Stacy, in closing, what message would you like to convey to families or caregivers who may have a youth or adolescent facing mental health challenges? How can they best support their loved ones in their journey to recovery?
Yeah. Take care of themselves. It's hard, and it can be tiring, and sometimes it can feel hopeless. And it's really important for families and caregivers to know that treatment works. Our outpatient team has multifamily programs that support the caregiver and the patient at the same time, so that the parents are learning the strategies at the same time the youth are learning the strategies to help get better. But parents have to take care of themselves, and that may mean finding their own support. And it's okay to not be okay, right? It's okay to say, I need a little bit of help. And the other part of it is just to know that kids can get better. And with time, with the right treatment, the right teams, the right staff, as Chelsea's identified, kids will make it through this. And there is a lot of help out there, even though it can feel as though there isn't. There's a lot of help, and people want to help make a difference.
I think Chelsea's a perfect example of that. Back to school, master's degree, wants to give back to mental health. Thank you both for joining us today. Your message is incredibly important. Thank you for joining us for Mental Health Matters. Looking back to this episode, should you have any questions, please feel free to visit our website, ontarioshores.ca.
Hello there, this is Karim Mamdani, and I'm proud to introduce myself as the President and CEO of Ontario Shores Centre for Mental Health Sciences. Thank you so much for tuning into today's episode and for joining us in these important conversations about mental health. I just wanted to take a moment to express sincere appreciation to the incredible team at Ontario Shores for their exceptional work. Our team of compassionate and skilled clinicians and staff work tirelessly to provide life-saving treatment and unwavering support for our patients and their loved ones who are facing the challenging impacts of mental illness. At Ontario Shores, recovery is possible and there is hope. I invite you to visit ontarioshores.ca to learn more about our work. On our website, you can explore our career and volunteer opportunities, learn about our programs and services, and find out how you can make a difference through donations.